Minister Harris, when you were serving as Health Minister, you said that by the end of 2017, no child would be waiting longer than 4 months for scoliosis procedures and that you were ashamed of the long wait times.
Yeah, and look, I said I was ashamed, and I saw again some media commentary saying, oh, sure, we don't need the minister to say he's ashamed, we need him to do something, and that's right, and I'm going to tell you what I'm doing. But we do also need a minister who doesn't just trot out lines to try and defend the indefensible. That situation is indefensible. We're going to fix it. We're going to make sure by the end of this year, no child waits longer in this country for a scoliosis procedure than 4 months. That's the commitment the Director General of the HSE has given. It would bring this country in line with the NHS. It's appalling how long people are waiting. The CRT Investigates programme shone a spotlight on what is a direct correlation with an inability to have invested in our health services over the last several years. We're now back investing. The failures in scoliosis are a direct correlation between the recession and the waiting times. We're going to get this fixed, and it's an absolute priority. No child will wait longer than 4 months.
Now in 2023, when we hear that there are still children waiting 5 years for these surgeries, were you just trotting out a line back then, and are you still ashamed of that?
Well, thanks, Ben. No, I mean, when I was Minister for Health, the situation in relation to scoliosis operations for children was extraordinarily serious. And we worked tirelessly to reduce those waiting times. The 4 month wait time is often thrown at me, and I accept responsibility and accountability in relation to that. But what people forget to say is that that was a timeline given to me by the then Director General of the HSE, a commitment that no child would wait longer than 4 months. And of course, as Minister, I put the resources in place to ensure that an extra theatre, for example, could be opened in Crumlin, that extra theatre nurses could be hired. I am aware, though, that sometimes when it comes to situations like scoliosis, the complexity of the medical condition can, not always, but can also interfere with the timing of the operation. So in relation to this, we need to keep at it, but it is a statement of fact that the action we took reduced the wait times for children. We had an unrelentless focus on that issue. And you know what? I'm actually pleased we did it. It brought about a level of attention to the issue that hadn't been there before. But is the issue solved? No, it's not. Do we need to keep at it? Yes, we do.
So notwithstanding the progress that was made, in hindsight, would you say you may have overpromised at that time?
I delivered a commitment that was given to me by the HSE. And in fairness, I want to be clear, I believe given to me in good faith by the HSE. I do believe that target led to a level of focus that quite simply wouldn't have been in place otherwise. And it did see many, many, many children getting their operations within that timeline. I do, though, think at the time it should have been made clear that the complexity around the surgery and the multiple medical conditions that some children can have can also play into those timelines. So I'm pleased the target was set because of the focus that it put on the issue. We need to continue, as I know the Minister for Health is, continue to work tirelessly to pursue it.